Assalam alaikum, my dear friends. This is Dr Esha Fatima. I hope you all are fine. This video is the final part of House Job Guidance series. In this video, I will discuss about all the wards of Jinnah Hospital Lahore. In addition, I will address some questions related to house job. If you are new to my channel, please like, share, and subscribe my channel. Before I talk about individual rotations, I should clear that this analysis does not include my personal opinion by any means. It is purely the extract of seniors' reviews and their experience. I am just analyzing it and presenting it before you. So, this analysis should be taken only as a review. I do not intend to do any favoritism or criticism. So, let's start our discussion with surgical units. There are four surgical units in Jinnah Hospital. We will discuss some specific points about each rotation, like number of house officers in that rotation, environment, overall experience of HOs, clerical work, technical skills, clinical experience, points for recommendation, points against recommendations, and seniors reviews. Regarding surgical unit 1, it has 30 to 35 number of house officers, 10 seats for private graduates, out of which 2 to 3 seats are paid. Environment is fully supportive, fully enjoyable, and fully hectic as well. 90% of house officers had wholesome experience in this rotation. Regarding clerical work, there is a lot of clerical work. Regarding technical skills, you can learn all the emergency skills and basic surgical skills. You can search my previous video for basic emergency and surgical skills. Surgical Unit 1 is regarded as the best unit of surgery regarding clinical experience. It is totally recommended by most of the house officers because of better practice, good work ethics, and supportive seniors. And there are no bed bugs in this ward. Points against recommendation are hectic schedule and more number of newly inducted residents. By seniors, it is regarded as the best surgical unit. S1 is the rotation of choice. You must do it if you like surgery. Now let's talk about surgical unit 2. It has 35 number of house officers, almost 10 seats for private house officers, but no data could be found regarding paid seats for private HOs. Regarding environment, there were very mixed reviews. Some found it supportive, while others didn't. S2 is also hectic, but less than surgical unit 1. Overall experience was moderate. Some found it wholesome, while others found it toxic as well. So, overall, they gave a moderate experience. In technical skills, you learn basic emergency management and surgical skills. Clinical experience depends much on your own effort. Clinical environment was regarded not as supportive as S1 and 4, but again, I'm saying these are individual experiences and there is a lot of variation. Points for recommendation are less hectic as compared to S1 and recommended more as compared to S3. Points against recommendation are that it is not considered an ideal option among the surgical units. Regarding seniors reviews, S2 can be your best rotation if you learn to adapt in the environment, but reviews of some seniors were quite different as well. Now let's discuss surgical unit 3. It has total 36 house officers, about 35 to 36 house officers, out of which 15 to 16 are private seats, but no data could be found regarding paid seats. Environment is less hectic as compared to first two surgical units, but it was also regarded as less supportive and a bit less enjoyable as well. Overall experience was from moderate to a bit toxic. Clerical work is much technical skills. You can learn basic emergency management and basic surgical skills. Clinical experience depends much on individual effort. You can learn basic management of all the common surgical diseases. Points for recommendation include easier schedule as compared to surgical 1 and 2. You can have good time after doing your work. Recommended to be kept with friends. It will be better. Points against recommendation are strict roster and a bit less cooperative seniors. Seniors' reviews regarding Surgical Unit 3 are they deduct your pay for leave or late arrival and strictness over ward timing. Now is the turn for Surgical Unit 4. It has about 35 to 40 HOs. There are a lot of house officers, but no data regarding the paid seats. Environment is fully supportive, fully enjoyable, and less hectic as compared to S1 and 2. Only the ward week of Surgical Unit 4 is regarded as a bit hectic. Overall experience regarding S4 is wholesome to moderate. Clerical work is not much. Technical skills, as much as you are keen to learn. Clinical experience also depends upon the HO's level of interest. No one will say no to your queries. Points of recommendation are less workload because of more number of house officers. That's why it has comparatively easy roster, very supportive seniors. A point against recommendation is only that it is not regarded as the rotation of choice. Seniors reviews are chill terrain ward, अच्छे seniors, no cons, all pros. Before I proceed to medical units, I want to introduce a new organization working for the benefit of medicos. It's PAMER, Pakistan Association for Medical Education and Research. It has launched its project named House Job Starter Package, by which you can order all the needed stuff and instruments for your house job. I am sharing their contact number on the screen. You can have a look at the details of this project by opening the link given in the description. You can use my code MEDICARA ShareCare to get discount on the instruments. Thank you. Now let's discuss about the medical rotations. There are 5 medical units in Jinnah Hospital. About medical unit 1, there are 40 house officers, a lot of house officers. Environment is supportive and enjoyable, but less hectic as compared to some other units like M2 and M4. Overall experience is moderate. It is neither toxic nor wholesome. Clerical work, not much because of abundant staff. Clinical experience was good to moderate, with a bit less emergency and OPD exposure as compared to other units because of one emergency per week and a special Sunday every 4 weeks. Points in favor of recommendation are its association with endocrinology unit and JADES OPD, where you can learn diabetes and thyroid disease management very well. Also, it is attached with Umar ICU, where you can learn all the technical and ICU management skills, and it improves your CV as well. So, overall, it has easier schedule with good environment and moderate learning. Points against recommendation are less ward space and less exposure to emergency and OPD. Seniors' reviews are if you want an easier rotation with moderate learning, then this ward is for you. Then comes Medical Unit 2. It has 28 house officers with 16 government graduates and 12 to 14 private graduates. Environment is very supportive, enjoyable but much hectic work routine. About experience, most of the house officers had wholesome to moderate experience, but a few of them also regarded it a bit toxic as well. There is a lot of clerical work because of patient load. You can learn all the basic emergency skills, and regarding clinical experience, you learn to manage all the common diseases, especially hepatobiliary. House officers are answerable in rounds, so you get to learn a lot. Points in favor of recommendation are they expect much from their house officers, so house officers have to learn a lot. They are very supportive. Their emergency day is same as nephro OPD, so more CKD patients get admitted in the ward. Also, it is attached with gastro unit and hepatitis clinic, and there is much patient exposure in M2. Points against a recommendation are very hectic schedule with a lot of clerical work. Also, recently there are more number of newly inducted residents. Regarding seniors reviews, it is the favorite ward and learning wise the best unit. Regarding medical unit 3, there were fair to good reviews. It is supportive because of some good seniors, less hectic as compared to other units. Overall experience is moderate. Learning experience like technical skills and clinical experience all depends upon your efforts and seniors availability. Clerical work is not much. Points for recommendation are good option and nice seniors, while points against a recommendation are less ward space and not considered the ideal rotation. Now let's talk about medical unit 4. There are 40 house officers, out of which 20 are private. So, a lot of house officers. Environment is very supportive, enjoyable, and moderately hectic because of a more number of house officers. Overall experience was wholesome to moderate. Clerical work is moderate. Regarding technical skills, you can learn all the basic emergency skills plus as much as you show interest. Regarding clinical experience, house officers get to learn management of almost all the diseases because of proper discussion with residents over the allotted patients. Points in favor of this unit are separate ward with proper roster and management, very good learning environment with least toxicity, supportive and competent seniors, but there is a little bit strictness in the ward, one may get extra duties as penalty over some issue. Seniors reviews are M4 is fairly good among all units, nice option available at the moment, in tough competition with M2 for being the best ward, and some also regarded it as the medicine best ward. Now comes the medical unit 5. It has 16 to 20 house officers, which are quite less as compared to other units. Environment is fairly supportive. Overall experience is moderate to a bit toxic. Clerical work is much. Technical skills, you learn basic emergency skills. Regarding clinical experience, it depends much upon your effort and time. So there are good to average reviews regarding clinical experience. Points in favor of this unit are that seniors are nice, but points against recommendation are short staffed, so gets hectic. Seniors reviews are mixed. Some found very good seniors, while others didn't have good experiences.